Hi, my name is Analise. I am a Sportsman 3 student at South Tahoe High School, and today I will be discussing sports psychology and mental health during injury and rehabilitation. Sports psychology is the study of how psychological factors affect an athlete's performance. Good mental health is essential in a healthy lifestyle and is extremely important for all athletes. Mental health plays a huge role in an athlete's performance, and it is crucial to maintain a healthy mentality during injuries and during the rehabilitation process. Athletes suffering from injury will undergo a grieving process. They will grieve the loss of their season or the sudden change in their expectations for their career or performance. An athlete's mental health can be deeply affected by an injury, and many athletes struggle to keep a positive attitude throughout the process. For many athletes, sports act as stress relievers. An athlete depends on his or her sport to relieve stressful factors in their personal lives. When injury occurs, the sport is taken away and the athlete's main stress reliever is gone. This causes a lot of extra stress for the athlete, because not only are they stressing about the injury and recovery of the injury, but they also stress about personal problems without being able to deal with it as they would normally. Athletes experience many feelings during injury and rehab. Although all athletes are different, most experience similar coping stages, including denial, anger, bargaining, depression, and acceptance. The denial stage often happens almost immediately after injury occurs. The patient is often left in a state of shock and disbelief and cannot understand the severity of their injury, causing stubbornness and ignorance. The anger phase often occurs when the athlete finally realizes the severity of their injury after the denial stage. Athletes will spend a lot of time blaming themselves and/or others for their injury and will experience high levels of frustration about their injury. Next comes the bargaining stage. Patients will often be desperate to return back to play and might express that they would do anything to go back to how things were before injury. After the bargaining stage, patients will often begin to lose all hope and will fall into a depression phase. Athletes may feel useless and think they won't ever recover. The depression stage may be very negative, however, it can lead patients to the acceptance phase because they will begin to realize exactly what has happened to them and begin to understand the healing process. In the acceptance phase, athletes reach emotional stability and are more willing to participate and cooperate in rehab and healing. There are many factors that play into a mentally healthy recovery. It all begins with how an athlete first perceives his or her injury. If an athlete perceives their injury as the worst thing that could ever possibly happen to them, it can lead them to anxiety, depression, and extreme loss of confidence. Because of this, it is extremely important that we start off on the right foot and with the right mentality. Athletes might also feel a lot of outside pressure from coaches and parents to recover as quick as possible. It is important that a recovering athlete ignores these social factors because they will distract an athlete from recovering at a healthy and stable pace. To develop the right mindset, an athlete must allow themselves to express their emotions by coping properly. They must be willing and ready for rehab and be open-minded when it comes to trying new exercises and strategies. It is also important that the patient eliminates thoughts of if only, because they will end up wasting too much energy on what they could be doing rather than focusing on their reality and dealing with their injury. It is also important that the patient reduces their focus on a time frame. Many doctors will give patients an estimated time of complete recovery, and many athletes focus too much on that, which can negatively affect the rehab process. By having an athlete create specific goals to reach throughout their recovery journey, They will be able to recover at their own pace and be more excited throughout the process because their improvement will be shown more clearly. Focusing on smaller goals rather than the end result will overall have a more positive impact on the patient's mental health. The rehab and recovery process is often very long, and many athletes lose motivation and want to give up at times. To help an athlete stay motivated, we can incorporate exercise into everyday activity. For example, doing exercise while watching TV or brushing your teeth. We can also help athletes stay motivated through reward systems. This keeps the athlete consistent and gives them something to look forward to while completing exercise. Because the rehab process is so long, athletes will obviously feel a lot of emotions during recovery time. All feelings during injury and recovery are normal, and it is important that patients find a way to deal with their emotions. Most athletes rely on their sport emotionally, meaning they express themselves through their sport. Because injury takes away their emotional outlet, it is essential that the patient finds new ways to express their emotions. Recovery is a perfect time for athletes to discover new hobbies or expand their creative side. Meditation and art are great ways for recovering athletes to maintain a positive mentality. Having someone to talk to and having a strong support system are also great for when an athlete needs to express their emotions. It is most important that an athlete does not feel alone through their rehab and recovery journey, especially because injuries can be overwhelming and emotionally draining for them. When an athlete's injury is completely recovered, the mental healing isn't quite over. Most athletes are not mentally ready to return to play. Most patients have a hard time trusting their body to perform without getting re-injured. It is important to determine how healed the athlete feels and determine if they trust that they are completely cleared. Recovered athletes often experience self-doubt, overanalysis of pain, and fear of re-injury. To mentally return to play, an athlete must take things slow and build up to returning to their sport. Begin with participating in drills and practices to scrimmages and eventually games once the athlete is comfortable enough and well adjusted to their body post-injury. Overall, injuries can not only cause physical damage to an athlete but also cause mental and emotional damage as well. Mentality plays a huge role in recovery, and it is extremely important to pay attention to mental health during injury and rehab. Thank you for watching.